My name is Guerard. I'm the CEO of Opthea. Opthea is working on a very exciting new development in ophthalmology, which is a drug called Sozinibercept, which is a first-in-class VEGF-C and D trap that is being developed to treat wet age-related macular degeneration, which is a disease affecting millions of patients around the world. This is very exciting because it could potentially, if we confirm our superiority data obtained in a phase 2b trial, it could be the first drug in the last 20 years to deliver better visual outcomes for patients suffering from this disease. So the medical needs still exist. Anti-VEGF-A's, which is the current standard of care, was a class of drug launched around 20 years ago that for the first time allowed these patients suffering from wet AMD to regain some vision, some of them actually being able to continue living independently. Now it is well established after 20 years that patients, not all of them, return to vision that allows them to live independently at home, drive, recognize faces of their friends and family, or even being able to read. So this is the gap we are trying to bridge by developing Sozinibercept as a combination therapy being used on top of standard of care to allow these patients to basically return to better vision. We also know now that a letter of vision loss every year is associated with an increase of mortality. So by developing Sozinibercept to deliver better vision for these wet AMD patients, we not only want to improve their quality of life, but we also want to improve their quantity of life in their late years. The phase 2b was a very interesting trial. It was very large, 366 patients, very well powered, with 3 arms comparing standard of care used as per label, Lucentis, given every 4 weeks for 24 weeks, to Sozinibercept, and Sozinibercept was added on top of Lucentis in 2 arms, one arm at a low dose, one arm at a high dose, and the third arm was a sham added to Lucentis. So it's very exciting because when you compare the visual outcomes obtained in these 3 different arms, you could see that the combination of Sozinibercept 2 milligram with Lucentis given as per label delivered a statistically significant superior visual outcome at week 24 compared to Lucentis alone. And that is a first, that is incredibly exciting, and that level of vision was very significant. It was 3.4 letters in the all-comers population, and more interestingly, 5.7 letters in the patient population we are studying first in our pivotal program of patients having minimally classic and occult lesions, RAP absent. And this is this patient population that will be first tested in our pivotal program. So the clinical program, the phase 3 program, which consists of 2 very large clinical trials of around 1,000 patients each, have now been fully enrolled as of earlier this year. And we expect the top-line data of the first one, which is called the COAST trial, which is studying the addition of Sozinibercept 2 milligram to Eylea, used as per label. This first trial will read in the early second quarter of 2025. The second trial, called SHORE, which is trying to demonstrate the same thing, which is the addition of Sozinibercept 2 milligram to Lucentis, given as per label, compared to Lucentis alone. That one will read out in the middle of 2025. The concept of Sozinibercept is really interesting. So as I said before, the standard of care are all anti-VEGF-A's. And they only basically reduce the stimulation of the VEGF receptors 1 and 2. These receptors are responsible for vascular proliferation and vascular permeability. So basically, the disease is this abnormal proliferation of blood vessels in the back of the eye. And these vessels start to leak at some stage and create this distortion of the retina and ultimately the death of the photoreceptors. What we are trying to do with Sozinibercept, and Sozinibercept is the first-in-class VEGF-C and D trap. So it's basically further blocking this VEGF pathway, reducing the stimulation of the second and third receptor of this pathway, better blocking this abnormal blood vessel growth and abnormal vascular permeability in the back of the eye. This mechanism of action has been known for quite some time, very well demonstrated in animals, and of course now we have a lot of clinical evidence in humans with our phase 1, phase 2 program already achieved, and which have demonstrated this statistically significant benefit in terms of visual outcome for the patients. I really think patients should be very hopeful that new therapies are coming. A therapy like Sozinibercept could really be transformational for them to live independently a bit longer, make sure they can keep enjoying life whilst having the disease, and ultimately live a fuller and more complete life by having better vision.